life-changing people, products, services, things that we count on every day, things that happen in those big buildings in your communities, in your neighborhoods, where all of the folks are employed and where big change is happening. How did they get there? How did that business get there? It wasn't just magic. Someone did it, an entrepreneur, a founder, a pioneer. You're about to meet one. Chris Chengelis joins us next on A Dash of Grit.
This is A Dash of Grit. Recipes for success from courageous leaders who overcome challenges and build great things. Now, podcasting from Spire to leaders in local communities like yours, here is Brian Leflock.
And let's get cooking. You know, we see these big companies, these successful businesses, we drive by and we know how big they are and how many people they employ, and we know how important they are to our communities and to our economies, but we rarely think about the people that went into the creation of that business. I know the real high profile ones, you know, we see those folks in the news, but 99% of the times we don't see the folks that are making these things happen and have built these big organizations. And I'm thrilled to talk to you today with one of the founding informative figures at Will Research, which is now Charles River Laboratories, the largest drug testing facility, and of course, a big part of the Ashland economy here. It's a pivotal company in the area of pharmaceutical testing, biotechnical industries, and Chris Chengelis is our guest today on A Dash of Grit. Chris, thank you for joining us. I'm excited to share your story.
Thank you, Brian.
And so, Chris, the show is about
Love
grit.
talking with you.
And I'm looking forward to talking with you, too. It's interesting. We've talked a little bit behind the scenes, and I understand very little of what you do. However, I do understand grit and growth and taking something from nothing and turning it into something very important, something I understand very well. And I know that that's what you did. And that's what we want to talk about is that grit. First, if you could, can you share with me a little bit about the success when you left Will Research and the things that were happening that you were most proud of, what success meant to you for that facility? If you can let me know kind of what success meant for Will Research, I appreciate that.
Success for Will Research at that time was making money.
Well, yes, absolutely.
We were a service providing company. We provided services to the pharmaceutical, biotechnical company and a few other industries who needed toxicological research services. We provided the data that was required for drugs to go into clinical trials.
Mm-hmm.
The success for me was looking at the number of completed projects that we did and then being able to point towards products on the market that we had been able to work on.
Mm-hmm. And that had to feel good.
That was one of my definite. Oh, it felt great. I had an uncle that had Alzheimer's, and he was taking one of the products that I worked on. I don't want to mention the product because I don't want to sound like I'm endorsing.
Right. Yeah, we're not going to mention specific projects, and I know that's important, but we're talking about life-changing medicines and
right.
You know, world-changing medicines. And in fact, right now, Charles River, which is the current owner of kind of took over kind of where you were, they're the number one. I mean, if a drug is going to get tested and put on the market, it's pretty much going through that. So it's a very successful organization.
Yes, correct. And my other criteria for success was the number of people that I helped along the way.
Yeah.
I used to say that I'm responsible for not only feeding my family, but the family of a lot of people whose livelihood depended on Will Research at the time. Yeah. So one of the reasons I did come back to Ohio is I felt I could help build something here in my home state that would be of value, a long-lasting value to the community and the state, and also to the people who eventually would be taking the products that we worked on.
Yeah, and you have done that.
And I think along the lines, they have a retirement. Yeah, after I announced my retirement, several people reached out to me to tell me incidences that I had not thought too much about, where we interacted, and it meant something to them in terms of how they planned their future career. Yeah. You know, so that was also very satisfying. I was able to do all that and provide for my family very nicely at the same time.
And that's kind of what I want to talk about, because that's what happens. These things happen, and we look back and say, "Wow, look at how great that is!" And isn't that nice? And we take some of these things for granted. I'm interested, Chris, if you can take me back a little bit, maybe to some of the formative years of Will Research, or even any time in between. But times when it was tough, times when you were trying to accomplish something, make that impact, make that difference in folks, and you just kept running up against hurdles, things that got in your way, whatever it might have been. I wonder if you can share some of those tougher stories that go behind the success that we see when we drive by now.
Well, WIL, by the way, WIL stands for Welcome Independent Laboratories. And the laboratory got started in Cincinnati in the late 70s and was purchased by the Great Lakes Chemical Company because of the Toxic Substances Control Act that was just passed at that time. And they thought they could make some money if they actually did some testing. So they went out and bought themselves a laboratory. And then after a few years in Cincinnati, the president of Great Lakes Chemical told the management at WIL, they were forced to change their name because Burroughs Wellcome threatened to sue them if they didn't change their name. Okay. So they contacted it down to WIL, and that's how it ended up being Will Research Laboratories. I guess it was a bit redundant because the L in Will stands for laboratories.
Right.
But anyway, so the manager at the time, the director of the laboratory, was from Worcester. So he came up and looked around the area and found the old Hess and Clark research farm.
Okay.
Over on the out on 250. I think everybody knows where that's at. Mm-hmm. And Hess and Clark had been sold a few years before that to Rowan Plonk. They sold the site to Richardson Vick. Richardson Vick tried to, for a couple of months, run it as a CRO, but it wasn't working out for them, and they were looking to sell the site. That's how we ended up here. Okay. So the management at the time bought the site and eventually moved the entire operation up to Ashland. Starting in the early 80s, by about 1986, however, the company was in real trouble.
Okay, what was happening?
Yeah. Well, they weren't getting any work.
Okay.
Essentially,
That's a common problem. Yes.
Like I said, it's you just can't. This is a service business, so you just don't make widgets and put them on the shelf and then lay people off. You've got to have people here ready to work when the work shows up, and if work doesn't show up, and then you're paying people not to do anything. So it's a kind of a vicious cycle.
Yeah.
So so the Great Lakes Chemical Company got rid of the management that has essentially brought the company here, and put a couple of their own people involved, and then went out and recruited a senior scientist to run the place. And they actually recruited two, Joe Holson and Crosby Tompkins, to run the place. And that was starting in about 1986. And they were just barely hanging on. They were very good in the area of developmental and reproductive toxicology, and they were able to get projects in through the door doing that, but it wasn't enough to really grow the company. I was actually at that time placing work at Will Research from my position at GD Searle in Chicago. I was giving them some projects to do, so I got to know the people out here fairly well. And to make a long story short, in the late 90s, they decided they needed more general toxicological expertise, and they knew me. And so they reached out to me and wanted to know if I'd be interested in working at a CRO. At that time, it was unheard of to leave the pharmaceutical industry to move to a contract research organization, because they don't really do their own original science. They work on somebody else's projects, and they do what they're told to do.
Yep.
But still, it attracted me because you still had to be good technically to do that job, And the job I was originally doing at at Will was very similar to the job I was doing, the bulk of my job at GD Searle, and it was called study directing. All toxicology projects that are conducted and eventually submitted to the FDA have to be done under the auspices of a study director who has sole responsibility for the conduct of that study, making sure it's conducted right, preparing the final report. It has ultimate authority over that study. So while I started off being the associate director of toxicology at Will, that was my primary job, was running studies. And if I wasn't the study director on studies, I was managing a small group, and then I was out getting business. And when I started at Will, we had no sales department. The senior scientists, including myself, would go out and drum up business. And it became a very successful model.
The scientist became the salesperson? And okay, yep. I'm interested in that.
Yep. We discovered that the people we were talking to didn't actually like talking to salespeople. No insult intended.
None taken.
At that time, the decisions made to place toxicology work at a CRO were made by the toxicologists at the drug company or the chemical company or the veterinary drug company or food company, whatever the company was.
Yeah.
They're all made by their own toxicologists. And they prefer to talk scientist to scientist. So we developed at Will and what was called a study director-centric model. We had no salespeople, and the sales, we would go out and do our own sales calls, come back to the laboratory, and either run the studies or somebody else would run the studies or whatever.
Yeah.
And we were fairly successful in doing that. So when I started at Will in 1990, it was funny. I'd have clients that would come to visit Will, get off the expressway and drive to us over there on George Road.
Mm-hmm.
So they wouldn't make it all the way into the city. And they'd say, "Gee, Chris, you must be the largest employer in town." And I said, at that time, I don't even think we were in the top 10.
Yeah.
When I started there, we had 85, 86 people approximately. And in my toxicology group, I started with 12 technicians and one other senior scientist in the group. And I sat down and looked at my horizon. I had enough work maybe to keep us busy for 3 months. And after that, I didn't know what was going to happen. And that 3 months came up, had some more work, So
isn't that the way it works?
Yeah. So we,
but it always wasn't just that easy. It didn't just show up. Let's dig into that a little bit. I think there's over 900 employees there now. It is one of Ashland's largest employees.
Yeah.
It's a huge success. And I'm wondering, you were at the point where you were the pipeline wasn't full. You just work on a project, wait for the next one to come in. What kind of major challenges did you see? And I'm sure they were real in growing that company to what?
Well, number one, getting people to just take us seriously.
Mm.
And so you had to go visit people. Like I said, it was face to face with the other scientists. It wasn't, we didn't have a sales group that would go out. And then to get them to take you seriously, you had to show them that you knew what you were doing. You had to provide them with good service.
Yeah.
Essentially, a toxicology project is based on what is called a protocol. You and the client have a long document that describes in detail exactly what's going to happen, how long a study, what are the doses going to be, how many animals, how many dose groups, what are the endpoints.
Mm-hmm.
It's all that detail. So you had to be able to present that and convince the client that yours was the place to do the study. So it was a very person-to-person business.
And was there something about the way you did it that was different than the alternative? I'm thinking to myself, the way this works is the drug company, the person you're talking to, it has to be right. It can't be, they can't just go by price. They have to pick the company that's most able to do things. So how were you able to separate yourself from other companies and make an impact that way?
Number one, we were very good scientifically.
Yeah.
We were very good scientifically. When
So
they
being
would
great at what you
to us,
do is important.
yeah,
Yes. Mm-hmm.
yeah. So when they came to talk to us, we could talk to them in great detail and show that we really understood toxicology and we understood how to test their product. The protocol had to be clearly written, and it's a place where you really had to pay attention to grammar and good spelling and all
Mm-hmm.
those and all those things. And then had to have a nice facility, and that was the biggest challenge, is that we didn't have that nice of a facility at that time. In the first couple of years I worked there. As a matter of fact, how we had people coming back and giving us repeat business with the facility that we had really boggled my mind looking back on it. I had to really do things to make sure there wasn't too much water on the floor, for example.
Oh my gosh.
That type of thing to really try to get the place spruced up, and so that when people came, at least looked cleaned up. And
did it ever come
actually,
to a point where that wasn't good enough, like just to sweep up the floors and clean? I mean, did you lose some business because of that? And were there some specific actions you had to take to get that fixed?
Well, yeah, we built a new facility.
That'll do it.
But but you never know for sure why people don't give you work. They don't always tell you honestly.
Right.
More often than not, it was because they felt more comfortable with another place. It might have been the facility. The other facilities may not have been all that much better than ours. You just don't know. But I knew that if you had a nice looking facility, that would certainly help.
So Chris, did when you got the new facility and you started to ramp up, I'm thinking there might have now been a time when it wasn't such a hard thing of getting the business. Maybe it was more hard to deliver. I mean, was there ever a time when you were growing too fast and that was causing some issues as well?
Well, let's just back up a bit. We made our first addition to the facility in 1991. Almost a year after I started, so we could do some more work, and that worked out very nicely. We had that filled up with projects in about a year.
Mm-hmm.
So then we added on another wing that totally reflected that facility, and then the place really began to look like a nice place. By that time, a few years after that, I was up to maybe 30 people in the group. By the way, 1990 was 1990 was the first year in years that we had actually turned a profit.
Oh my! Okay.
At will. So
profit is nice.
Yes. And then that worked out nice, and it was about 1994, and then into 1995, we made a major addition that really brought the place, doubled our capacity, and really gave us some nice looking, well controlled space. And that's the building now that has the majority of the work in it on campus there.
Okay.
And then we turned all the old laboratory space into office space in the building that's right off of George Road.
Okay.
And that's when we really began to ramp up and get people in. And to answer your question, at times we had to turn work away because we had more requests than we could handle. And it's not the type of business where people are going to wait for 6 months. It's a little bit like the hotel business. You don't build space just to have it sit empty.
Right.
So if somebody shows up, they take the next space. And if somebody shows up and you don't have any space, you just have to tell them that, I'm sorry, we can't handle it right now. Your next starting point for this project is someplace in the future. And if that someplace in the future didn't meet their needs, then they would usually go someplace else, as much as they might have liked working with us.
Right.
So, and then we continued to grow after that, and we had several additions onto that building. And now we had, when I left, it was over 300,000 square feet of laboratory space sitting back there off of George Road. And that didn't include the sites that we had purchased over the years as well. So we had maybe 600-700 people here at our zenith in the late 2000s, when the turn down in the economy caught up with us.
Okay.
Which was another challenging time. But actually, we were having trouble finding people to work there.
That's a common problem even today. It's tough to find good qualified employees that allow the business to expand.
Yeah, I mean, and because it also takes, you hire let's say a bachelor's degree with biology, it takes maybe 6-7 months before to get them trained up so that they're fully productive.
Mm-hmm.
And our thinking was at that time that we might not be able to recruit heavily enough in this area to sustain growth at that site. That was our thinking at the time. Whether or not it's worked out that way with Charles River or not, I don't know. I still go in there.
What kinds of things did you do then to address that issue? You thought it would be a problem. You knew you saw the issue. What kinds of things did you do to make sure you had enough workforce?
Well, we increased salaries.
Yeah. Okay. Good.
and put programs in place to reward people faster for experience and for doing good work.
Yep.
And then we tried not to work the bejesus out of them. So it was all those things, and I think a lot of those things, from what I could tell, Charles River picked up on and kept in place. They changed some of the titles of some of the positions, but it's pretty much the same work. Yeah. I still go in there, by the way.
Oh, do you?
Yeah, on behalf of my clients, I get to go in there, and it's been 7 years, and so most of the people that are working there probably never heard of Chengelis.
Yeah.
But it's very nice to see the number of young people working there with very good professional jobs.
And Chris, can I ask this question? And the answer might be, yeah, Brian, that's it. Here, you are a very, I don't know if humble is the right word, but you're a scientist who puts A and B together and gets C, and away you go. And you've told me so far that you were at this company that was small. You became a salesperson, brought in your own work. You added facility space. You increased employees, and voila, success. And I know that that's the formula. But was it had to have been harder than that?
Well, I don't know.
Maybe not.
Well,
maybe that's all it takes.
And maybe, every job has its challenges. One of our challenges was dealing with Great Lakes Chemical, and they never really fully understood what to do with us, other than the fact that they liked our profitability at one time. So dealing with them was a bit of a chore.
And who were they, and why was it a chore? What was the issue?
Great Lakes Chemical. Well, they don't exist anymore.
Okay.
They at the time, they were the largest provider of fluorinated chemicals, brominated and fluorinated chemicals in the United States. They were the leading seller of methyl bromide. Okay. For example, they had purchased Will Research because they thought that Tosca would require a lot more testing, and if they were going to have to do testing, they wanted to get in on the action of chemical testing.
Okay.
Well, Tosca was never fully enforced because soon after it was passed, Reagan came into office, and he had a different view on enforcing Tosca. Be that as it may. And so a lot of testing from the chemical industry the commodities chemical testing never really came out. Pesticides and pharmaceuticals were our major products back in our major clients back in the early 90s. And the pesticide business has kind of gone away because there's not a whole lot of new pesticides being developed. So right now, Charles River Will Research, the site in Ashland, is almost 100% pharmaceutical business.
And so let's talk about that a little bit.
Molecules are coming from.
That's what I'm interested in now. As we start to wrap up here, I'm interested in the future. And I know you're retired from Will Research, and of course you're able to go back into Charles River. But you have Chengelis Scientific Consulting Services, and you're doing work now. And right now, with I mean, everyone knows about COVID, and no one knows what it is, and yet there has to be so much work being done in testing and things of that sort. For you and for your consulting service, what's the biggest challenges that we're facing moving forward? What are you facing moving forward? What are you trying to solve? What are the hurdles that you have to accomplish here for yourself here moving forward?
Well, as a consultant, I'm back doing my own sales work, I guess.
Mm-hmm.
You have to get your own clients. And I'm essentially, I really don't need the work. I just do the work because I enjoy the work.
Sure.
So for me, if I have enough just to keep myself busy, that's fine. So I don't spend a lot of time going out and trying to recruit clients. Basically, I've got a handful of people that just come to rely on me, and that's the people I take care of.
Yeah.
And then the interesting thing, actually, one of the interesting things about working at a CRO, that if you're interested in toxicology, it's a great place to work because you see more different chemicals, more different drugs, more different routes of delivery, treatments for more diseases than you would ever have seen working at at an individual pharmaceutical company. And it's the same thing with being a consultant. Whatever one of my clients, whatever issue they have, if it requires toxicological expertise, I can help them solve it. And that's what I do. So if it's going into Charles River to check up on how the work is going, I'll do that. If it's to sit at home and do a broad literature search and write an opinion, I can do that. So it's just a variety of different projects. I've actually worked on environmental impact statements, which is something I'd never had to do before I was a consultant.
Mm-hmm.
So it just whatever somebody needs in terms of toxicological consulting, I'm there for them. So that's basically what I do. And if I don't have an active client, which doesn't happen very often, but it happens, then I take care of my garden, play with the grandkids, and life moves on. Now, in terms of specifically, you asked me about COVID. Right now, I don't have any projects specifically involving COVID. I'm just keeping up with the literature. Like everybody else. And just want to tell everybody that this disease is the real deal. It's an extremely serious and capricious disease. And by all means, take all the precautions that the government is asking you to take.
Okay.
Yes.
Yeah, from a scientist's point of view, don't let other things get in the way. Do what you're told and do what you don't understand, and it'll come out better on the other side. Is that kind of what you're saying?
Yeah. What I'm trying to say is that if you need surgery, you want the best surgeon in the world available to you to do the surgery. You don't want a congressman.
Right.
You don't want. You want the best healthcare professional to address your issue, and that's the mentality we have to take to this.
Yeah, we have to listen to the experts.
Yep.
So, Chris, I am interested though also in the growth of Will Research up into Charles River, and maybe different organizational structures and ways that you were able to accomplish those things. Can you talk a little bit about transitions for Will Research?
About 2004, we were doing very well, and we got drew the interest of a group of investors who were interested in establishing what they called a first-in-class scientific services firm. And without going through all the details, we met with them, and then and this was also at the same time when Will Research was being shopped around by the Great Lakes Chemical Company. They decided that they wanted to divest themselves of Will Research for whatever reason.
Okay.
We actually did not want to go through the auction process, with an investment banker, you go out and get bids and all those things. We did not want to go through that process. And by we, I mean it was Joe Holson, Mark Nemec, Jim Rudar, Dan Sved, and myself. We were the 5 senior managers
Okay.
at the site at that time. We actually were approached by this group of investors who brought us to the company called Berman Capital, a private equity firm out of New York, who actually came out and so there were about 7 of them, and there were about 7 of us, and they took us out for dinner down at the cabin. It was for me. It was very interesting because I'm always used to as taking clients out for dinner. So this was a
This
novelty.
time they were wining and dining you, right?
Dining us, and
I like that.
yeah, and we discovered we had a very nice rapport with them. To make a long story short, we went to Great Lakes Chemical, the 5 of us, and told them, okay, we have this preemptive offer from Berman Capital for this company. If you don't take it, all 5 of us are going to walk.
Oh my.
So you either take this or we quit. They were being advised at that time by Lehman Brothers. For all I know, it may have been the last thing Lehman Brothers did before they went into bankruptcy.
Okay.
Back then.
Pick your partners carefully.
Yeah. The lead investment banker from Lehman Brothers that was advising Great Lakes Chemical at the time looked at the deal and told Berman Brothers they should take it. And if they didn't take it, Lehman Brothers wasn't going to be responsible.
Okay.
So they essentially had no choice but to take the deal.
Yeah.
So that's what happened. So we sold out. They sold us to Berman Brothers in 2004.
And so what opportunities did that create? What challenges did that create, that new transition?
They wanted to use us as the platform company to build a larger scientific services company. So right away, they had a vision for expansion that we weren't getting from Great Lakes Chemical.
Okay.
They also incentivized us by giving us a percentage of the company.
Okay.
After that.
And does that change your structure? You were a manager and you were a founding person and you were moving it forward. Now you're an owner. Does that change the way you look at things? Does that change how you operate on a daily basis?
Only insofar as now I had a lot more people, so it wasn't as personable. And now we also had to prepare reports for the outside group of investors. And Berman Brothers was very nice to deal with. They would come in and visit us once a quarter, 3 or 4 of them. They'd walk around, they'd talk to us, ask us if we're getting what we need. Are there any issues that they need our help with? They were an excellent partner.
And Chris, I'm wondering if is it hard as a scientist to now become an owner? Because all I heard just there, that was interesting. Now we're doing reports and now we're whining and dining. That's not what a scientist does. That's what a CEO does. Was that a tough transition for you?
No.
No.
It was very interesting. I mean, it was very interesting. I didn't do as many, I was active at the bench, if I can use that term, up until about 2004, 2003. I continued to run projects and have my own clients because I continued to believe that you have to know what your senior people are up against.
Gotcha.
So I would continue to run projects up until then. So I would run fewer projects, and then I would also spend more time now looking at new technology and how I might be able to expand our technology base and offer more services. I was doing more of that at the time. I guess it just came naturally. Scientific leadership just came naturally to me. So that's and it was a fascinating time because now we also got to spend time visiting other laboratories that were potential targets of acquisition and doing technological evaluations and trying to determine how those companies fit with your companies and evaluating what we had and was the best way to go out and buy expertise or try to grow it organically. Sometimes it's better just to go out and buy it so you have it and you don't have to worry about growing it. For example, I recognized early on that we had a weakness in pathology, and that so we ended up buying a pathology company down in North Carolina, and that's to become our pathology group, and that's how we ended up with a facility in North Carolina.
Hmm.
The investor group that bought us wanted to be an international company. So that's how we ended up visiting a laboratory in the Netherlands and deciding to purchase them. So I got to go to the Netherlands for about 5 years, once a quarter, to check up on them, and that was a lot of fun. And then
Yeah.
seeing the cultural differences in the way they would run their company
Yeah.
versus the way we would run our company was very interesting also.
That's what I was going to ask. Is there, when you were buying these companies, they have their own culture. Was it hard to bring them into the fold? Did you just allow them to continue to do what they were doing, or how did you keep the culture of Will together?
If we didn't like the company culture, we moved on.
Didn't buy them.
If we didn't think it was a good fit,
Yep.
we moved on. We must have looked at, for example, I thought we were really weak in the area of immunochemistry, being able to do those types of assays. And so it was probably better for us to buy a company. And we must have looked at 3 or 4 of them before we bought the company that we did, which actually ended up was at a research park outside of Chicago, at the site where I used to work before I came to Will. So it was kind of like my life went full circle when I had to go back and visit them. So that was a challenge, and that was interesting, and it was fun at the time. So we ended up buying 4 other companies. Actually 3 other companies under Berman. And then Berman got a preemptive offer themselves for Will Research. And they were fiduciarily they had to take the deal. The offer was for 5 times more than they paid for Will Research 3 years later. And so they had to take the deal. I still keep in contact with a couple of the people there. That was in 2007 when they sold Will Research to American Capital Systems. I still keep in touch with at least 2 of them since 2007, and they can tell me the day, the time, the date, the minute that they closed the deal.
Oh, I bet.
Yeah,
I bet. That's 5 times growth, and they just like that. Away they go.
And then the first couple of years under American Capital, things were great, and then we had the turn down in the economy.
Okay.
And up to that point, as far as American Capital was concerned, we could do no wrong. Everything we did was great because we were making money. We were meeting our targets and all that type of thing. And then the turn down in the economy came. And with contract research, it's not in the same sync as the general economy because people just aren't going to pull their plug on their ongoing projects.
Right. They have to follow it through.
Yeah. So some of these projects can take 6 months to 2 years to run. So they're going to follow it through. Mm-hmm. But what happens, the orders slow down coming in. Mm-hmm. And then, we're still busy at the beginning of the turn down in the economy. It was towards the middle of the turn down that we really got slow.
It got slow. And what did you do to change that around?
We tried to ramp up our sales process, but at the same time, American Capital was convinced that they made the wrong move and that they didn't have the right people there. So we went from not being able to do anything right to not being able to do anything wrong to not being able to do anything right. And I remember them telling Mark Nemec and I, insofar as they can tell, we've never failed to deliver technically. They just wanted to get people in that had more corporate sales experience to try to turn this around. And then we actually had to lay some people off. It was about maybe 10% of our employees.
How did that make you feel back then?
Not great.
No,
not great. Nobody likes doing it. At least I didn't like doing it. But you can't pay people with unexistent money. I mean, the money comes from performing services, and you're kind of stuck. If you get rid of people and the work comes in, then you won't have the right trained people to address the work. Yep. So you do the best you can to hold on to people and find something meaningful for them to do, even if that's repainting the walls or something like that.
And so what happened to allow that to improve? Did your sales increase because you made them increase, or did
Well,
you
that
just
was
have
the
to wait for
first.
the economy?
That was when they finally went into the senior management that was brought in by ACAS was all about a corporate sales force.
Mm-hmm.
And that's when they went away from the study director centric model and had independent salespeople, what they called the sales professional. So it was the culture started changing, and
Yes.
the language started changing. And I decided that, for example, you don't sell something, you increase demand for it. That type of
Sure. Yeah.
that kind of language,
Yep.
you don't assign tasks to people, you allocate resources to them. And so it was just a culture that I was beginning to enjoy less and less. So eventually, about 2013, I decided it was time for me to move on while I was still able to move on.
Yes.
And I was actually the last member of the original management team to leave the company.
Yeah. So you stuck it out all the way until the end. Very well done.
2013. Yeah, I retired. I was 63 years old when I left the company.
Good for you. Well, you left your mark on it. That's for sure.
Yeah, and they were very nice. They gave me a very nice send off and everything. So I have. I don't want to say anything too negative about the people. It was just that it was a different culture for me.
Yeah,
And now,
corporate world is not for everyone, and you built a company that just it becomes corporate just on the mere size of it and the amount of money and the responsibilities, and it just you built this thing, and then unfortunately you kind of have to almost like allowing your kids to leave the house when they're old enough, right? Yeah.
well, yeah, and at the end of the day, Brian, it's a business. As much as I enjoyed it, and as much as I think I helped build something that was of value for the community. It was a business. It was just time to leave and let somebody else move it along.
Yeah.
So there you go. And things picked up. The people that were still there, responded to the challenge of the new ownership and the new way of doing things, and then they were purchased by Charles River in 2015. So I think it's been about 5 years now. Yeah, 5 years, and
Yep. Wow.
and Charles River now has something like 1,100 people that work out of that site. A lot of them telecommute. I'm not sure what the percentage is, but I know there are people that report into that site, but work at home.
Yeah, well, especially now. My last question, Chris, before we wrap up, and then is you left what you were doing and joined a very small organization, and you sit there on your porch now, and you could almost throw a rock over to that place. And I'm wondering if I ran into you in an elevator and said, "What are you most proud of, Chris?" It has anything to do with that building over there. What would you say it was?
The people. The people that I worked with and the people that I left behind are still there. The site director, or actually the site director over there now, started as a technician in my toxicology group. I just love talking with her, and she reminds me of the words of advice I gave her back then. So I'm very proud of the fact that I created an opportunity for people, and that it's helped them attain success and something of value for themselves and their families as well. And I've got several people over there I could talk about in that direction. Yeah, the buildings are nice, but it's always about the people, because you don't get good science from the buildings, and you don't get good service from the buildings. That might get people there. But at the end of the day, you have to have good people doing good science for their clients. And I think the people that I left there and are there now are doing that.
Very good. Chris, I'm wondering if there's some folks now that like your approach to business and might even have some need to reach out to you in your consulting firm, Chengelis Scientific Consulting. How might they reach out to you? Is there an easy way for them to contact you?
Oh, I'm on LinkedIn.
Okay.
Yeah. And then if they want to reach out to me, they can reach me at Chengelis at cs2talks.com.
Chengelis at cs2talks.com.
Yeah, Chengelis Scientific Consulting Services. 2 C's, 2 S.
I like it. I like it. Very good. Leave it to a scientist to create some kind of a formula for the email. Well done.
Okay.
Thank you, Chris. The story is amazing, and I really appreciate everything that you've done, not just for Ashland, but for yourself and your family and those people that you're talking about. And then I think maybe, I don't know that you think about this much, but for the rest of the world that's relying on the products and services and things that you folks are over there testing and making sure they're safe and those kinds of things. So thanks for all you've done.
Yeah, I had a great career. And at the same time, I helped a lot of people doing both with the drugs they were receiving and with the careers that I helped develop. Yeah. So, yes, thank you.
You got it. Chris, this has been great. Thank you very much for your time. I really do appreciate the conversation.
Love talking with you, Brian.
You got it.
Some other time.
You got it. You got it. Enjoy the day, sir.
Thank you.
All right. Bye-bye. So, Chris, thank you very much for being a part of our show. We do appreciate it, and I thank you for joining us on A Dash of Grit. A Dash of Grit is brought to you from all of us here at Spire. We are here to help your business, your organization grow. We're here to serve leaders and managers and CEOs and folks that are trying to make a difference, just like Chris and has been able to do over his lifetime. And so if you are interested in learning more about Spire Advertising and the things that we offer, please reach out. It's spiread.com. And if you're listening to this podcast and you click the contact sales button, I'll answer and maybe I can help you. So I look forward to those conversations. Thank you again for being a part of Dash of Grit. Thank you to Chris Chengelis of Chengelis Scientific Consulting Services, and of course, a pioneer for Will Research and Charles River Laboratories. This has been A Dash of Grit. It's a acquired taste in your recipe for success, and we'll do it again next.
This is A Dash of Grit. Recipes for success from courageous leaders who overcome challenges and build great things.